What is urinary incontinence? Have you been suffering with some dribbling or a leakage or difficulty making it to the bathroom on time and you're not sure what's going on? Especially if this has happened suddenly, it can be extremely concerning. And I'm sure that you've looked all over the internet to try to understand more about what's going on and if this problem can be solved for you. So that's what we're going to be talking about today. What is urinary incontinence, including the different types of urinary incontinence, because that's really important, as well as the frequently asked questions that I get regarding urinary incontinence and your potential to heal from it. Ready? Let's go. First off, what is urinary incontinence? So the very basic definition is the fact that you're losing urine or dribbling or leaking when you don't intend to. Now, for some people, this only happens at certain times, like when they're really full. Some people, it happens when they're laughing, coughing, sneezing. For some people, it happens when they're running or with higher level impact activities. And what happens is that people don't deal with it right in the beginning when it starts to become a problem, and it will slowly progress over time. So what you may find is that you've started with one type of urinary incontinence, but it has changed and morphed and potentially even gotten worse since then. Now, what are the different types of urinary incontinence? The most common type I see in the clinic is stress incontinence. So this is when you are leaking, when you're coughing, sneezing, laughing, things like that. So this is the one. I was at a party a few years back, and it was a bunch of ladies sitting around having a good time, laughing. I don't think I've ever laughed so much as I did that night. And one lady jumped up and said, "I have got to go to the bathroom before I pee my pants." And it was really fantastic because I was like, hey, I have an exercise for that and I can teach you all. So as soon as she got back from the bathroom, we all did the exercise and they got to learn how to treat their pelvic floor while they were just at a party. Anyway, I am going to link that video at the end of this one for that exercise because it is the key thing that I always recommend people do with pelvic floor dysfunction or any urinary incontinence. Anything like that, it is my favorite pelvic floor exercise. And no, it is not a Kegel exercise. I do not like those, but you can listen to that video and that rant there. Now, the second most common type of incontinence is urge incontinence. So this is when you have a very sudden need to go to the bathroom, like sudden, like I have about 5 to 10 seconds to get there, and then it just starts coming out. Urge incontinence is usually caused by a different system than stress incontinence, but there's also mixed incontinence, which is when you have urge and stress together. Now, most commonly it starts as stress incontinence, which is why it's so important if you're having that stress incontinence, that laughing, coughing, sneezing incontinence, that you work on it right now and deal with it right now, because often it will turn into an urge incontinence or a mixed incontinence where you have both going on. And when you get to that point, it just becomes more difficult to treat. So when you treat it, when it's not that big of a deal, it's much easier to treat. And that's what I often tell people. They say, oh, it's not that big of a deal. It only bothers me, this and this and this. A lot of times people will stop going to the trampoline park or the bouncy house with their kids because they're like, oh, I can't do that, or I have to pad up before I do that. And they think it's not a big deal. And I understand that when you're in your 30s and 40s, that's not a big deal. But friends, I'm going to tell you that issue in your 30s and 40s, in your 50s and 60s, it turns into a much bigger deal. That's when you start having that urge incontinence. That's when things start getting a lot worse. Your mobility decreases, which further affects your pelvic floor. And this becomes a very cumulative type of thing. So if you're like, yeah, I have stress incontinence, but it doesn't bother me that often. I just avoid activities that are going to cause it. And it's not that big of an impact into my life. I'm super happy to hear that. But please get some help, get some treatment now, because most commonly it is going to progress and become a bigger issue as you age. The third type of urinary incontinence is overflow incontinence. And what usually happens here is that the bladder gets so full that it kind of dribbles or overflows. And this is caused by difficulty being able to fully empty the bladder. Now, most commonly what I see in the clinic is that overflow incontinence is caused by a very tight pelvic floor. Of course, there can be other issues. There can be neurological issues and things such as that. You would want to see probably a urogynecologist who may send you to a neurologist to understand better what's going on with that issue. But most commonly in the clinic, what I see is a very tight pelvic floor, where your pelvic floor has difficulty relaxing enough to fully empty that bladder and get that urine completely out. And the fourth, well, technically the fifth, because we already talked about mixed incontinence, which is urge plus stress. But the fourth we're going to talk about right now is functional incontinence. Now, this is when you have difficulty because of a physical impairment being able to make it to the bathroom in time. So usually what I see this in is older women who have difficulty with their hips, or they get sore when they sit for too long and they just can't make it to the bathroom in time once they realize that they need to go. I have also occasionally seen this in women who know that they need to get up out of bed and go to the bathroom, but they just roll over and go to sleep. And, again, you can get away with that when you're in your 30s and 40s, but as we age, ladies, we cannot get away with that anymore. So I definitely encourage you, if you find that you have a functional impairment, that you're starting to have difficulty making it to the bathroom in time because hips or low back or SI joint, that you work with a physical therapist who is a specialist who can help you treat that. Because honestly, it doesn't get any better as we age. So we want to make sure that we are keeping our mobility so we can make it to the bathroom in time, because, right, who wants to wear Depends for the rest of their life? All right, now frequently asked questions. The most frequently asked question I get is urinary incontinence permanent? And I hope you can see, as I've explained the different types of urinary incontinence, it is not necessarily permanent. However, it is not a situation that tends to get better on its own. Most people I see start experiencing it in their 30s, after they have children. They're told that it's normal. This happens to everyone. It is not normal. Yes, it does happen to everyone, but that's because people aren't told how to get help in their 30s so that this doesn't become a problem later on as they get older. You can probably see that most often incontinence kind of progresses over time and it becomes a more difficult issue as we age, of course, as everything does. So it is critically important that you get help for this as soon as you start experiencing any symptoms, whether that's your 30s, 40s, 50s, 60s, or 70s. And if you have made it to your 70s with no symptoms of urinary incontinence, that is fantastic. But definitely make sure that you get help as soon as possible because, of course, as we age, it also becomes more difficult to heal. Which leads to question number 2 is, can urinary incontinence be healed? Now, the thing is, the bladder is just responding to the forces that are being put upon it. And there's a ton, right? There's the pelvic floor, there's the hips, there's the low back, abdominals, you've got the pressure in the abdominal cavity, you've got the diaphragm and the pelvic floor, you've got postural issues, how your hip mobility is, of course, the nerves, the lymphatic system is all up in there too. So can it be healed? Yes, but you need to understand what is the root cause. You can't actually heal the bladder because the truth of the matter is the bladder is probably not the problem. It's probably all the other tissues around it, and it could be organs or fascia or low back or hips or SI joint. And it's important to understand what structure is it that's putting so much pressure on the bladder and causing this problem in the first place, which is why it's critically important to work with a specialist. There's lots of information that you can find online, but you don't know if it applies to you. And that includes this video. I'm trying to provide you as much education as I can so you can make good decisions, but I don't know your particular circumstance. So the challenge is that you need to find a specialist who can look at you and your body, who can hear your story, and who can help you understand what is going on with your body. And the final question that I most commonly get asked is, will urinary incontinence go away? Now, with my patients who I see in the clinic, yes. What we do is we start with a full evaluation to understand what started this urinary incontinence in the first place. And also that tells us the path that we need to achieve for full healing of this issue. And then we work together as we walk down that path to work on whatever the restriction is that caused this problem in the first place. And that can help the urinary incontinence to go away. It's not just giving you exercises. It's not just telling you to change your toileting habits. It's not all about what's in your mind and how you perceive this. Although all of those things can be important in your treatment, most likely there is actually a physical impairment that's leading this problem and that's causing you to struggle in this way. And you need help dealing with that. Now, I do admit that as urinary incontinence progresses, it shifts our mindset. I have had patients come in who only go to one store per day because they need to know exactly where the bathrooms are and make sure that they can get home without having any problems. I have had patients who will not go on long flights because they are afraid that they will get stuck and not be able to make it to the bathroom, which has limited their travel. I've had patients who have had to make significant life changes. And the challenge is that our mind really wraps around that and accepts that as our new reality. So yes, we do have to do some mindset shifts as the physical changes are happening. But this is not all in your head. We have to have the physical changes, and then we have to help your mind accept this healing, which is a different challenge. All right. From this far away, it is really difficult to speak specifically to what is going on with you and your urinary incontinence. However, I hope that you have found this helpful to get some ideas on what specifically is going on with you. Now, I'm going to encourage you to go check out this video if you struggle with any type of urinary incontinence. It's going to help improve the tone of your pelvic floor. If it's too tight, it will help. If it's too loose, it will help. I recommend you do this exercise twice a day if you are struggling with dysfunction. Now, if you're just a woman with a pelvic floor, which if you're a woman, you have a pelvic floor, then I recommend you do it once a day starting now. It's a great exercise to maintain pelvic floor health and control urinary incontinence for the future.